Good morning, this is Amanda Kimball, and I am presenting today a project that shows the severity of COVID-19 as a function of health indicators. You see presented before you is actually the Center for Disease Control's COVID-19 case and death data. It has been aggregated by the Census Bureau statistical regions. And then I took the case or the deaths and divided by the cases to standardize percent death rate across the United States. Each of these values is going to be used to predict whether or not age, weight factors, and other health indicators such as heart disease, cholesterol, diabetes, and kidney disease impact the severity of outcomes for any given region. Here I present a geographic version, just like before, but I've broken it down by what is also put together by the CDC. It is the Behavioral Risk Factors Surveillance Systems output. That data set is a set of survey values for each region. They ask questions of individuals within households, such as what age are you? How much do you weigh? What is your height? Have you ever been, in this case, told by a doctor or nurse that you have high cholesterol? You can actually toggle through this indicator name window to look at whether the population has health coverage, whether or not they have cancer, etc. Or you can maybe select your region. Mine is the Denver metro area, and you can actually look at all of the health indicators. They're down at the bottom in the box plots. You can see that for the most part, the Denver region has low levels in most of the health incomes, but we're kind of in the middle range when it comes to healthcare coverage and smoking cigarettes. Here's that same data set, but this is actually showing the different weight profiles for the population. In this case, I'm looking at overweight, but you can also look at obese, extreme obesity, underweight, and normal weight. Each of these is defined, and it says it up there in the left-hand corner of the slide. Underweight is 18.5 or less kilograms per meter squared. And again, you can select a region such as Denver, and you can look at the weight characteristics across the board for that individual region and see that for the most part we have a low extreme obesity and obese population in my area, and a high normal weight group. And this is all of the indicators together. You can search for a region, and again you can see those data points directly if you wanted to look at your region. This is all of the data plotted against the 4 most important characteristics, and most important was defined by mathematical models for importance throughout. I used decision trees, random forest, as well as SVM models. These 4 categories came up in all 3 of those modeling techniques. The other one that comes up on occasion is diabetes, and instead of high cholesterol. Overweight and normal weight are 2 categories that vary back and forth as far as whether or not I should be using normal weight or using the overweight category. For the weight categories and the age categories, when I modeled it, I only used one of the categories just because of the multi-collinearity between the different age values. And we'll look at a correlation matrix here in a minute. The thing I wanted to point out with all of these data sets is these outliers that are out here in the 9, 7, even 5 region. There's about 5 data points. It really made it difficult to model, and as you can see, pulls the data down in a strange way that doesn't seem significant. And we can look back at the box plots. These are all outliers on the box plots. So in this case, for modeling purposes, I made all of the values above 4. So when we look at the data only to 4, you can start to see some trends in the bulk of the data set, and ignore those outliers that are really at the high end. I do not think that within my data set, I have the right variables to model those higher end values. I suspect that has more to do with testing and or maybe the methods used in the hospitals for treatment of patients. Testing being low in cases, methods, and the hospitals being high in death rate in deaths. So here's the correlation matrix for the data set, and you can see that the age 50 to 60 against death rate, our category is probably the highest correlation value, and again comes up as an important variable throughout the models. You can see that all of the health indicators, which are in the center of the graph, make a nice big red square, which means that diabetes, kidney disease, heart disease, cholesterol, and general overall health, all of those have multicollinearity. So modeling one or the other is probably preferred. And what I find is usually one of those has a high importance, and modeling the others either has no impact on the model when you add them in, or has a negative impact on the model, which is not what we want. The same thing, you see a nice square up here for the older age groups, and you see a negative correlation for the younger age groups. Sorry, down here. Again, I'm only picking one age group, although it's always possible that having an older age group and a younger age group population statistic would be a good idea. And then for the weight categories, you see that for the most part, they correlate with each other. I had a tendency to end up with the overweight category and none of the others. And again, seem to either not help when you added in a second weight category, or it would hurt the model, meaning the accuracy would go down and error of the model would go up. The first model that I attempted was a decision tree. This led me to a better understanding of the most important variables. As you can see, the most important variables for these are really the uninsured group, the age 50 to 60, the overweight population, and those with cholesterol. This other model I show you is actually a categorical model as opposed to the regression model. And what I ended up doing there was breaking the severity, deaths per cases, down by their quartiles. And so the lowest quartile is your lowest severity, and the top quartile, which is 2.74 and above, and we truncated the data at 4, so it makes a lot more sense when you look at quartiles, is your severe regions. Well, once I optimized decision trees, a random forest model, as well as a linear SVM, I plotted those as I made them. I plotted those against their predictions to see what that looked like. And what you can see is that there's a lot of scatter in the individual decision tree. It didn't quite model the data, and the accuracy of that model is unacceptable. The random forest model brought the data a lot closer. We have a lower error across the board, but again, we're kind of missing, and it was the same in the decision tree, missing really the lower end, right? Everything above below 1.2 is not predicted, and anything above 3 is not predicted. That lack of information led me to want to model it a different way. So I looked at a support vector machine model, and as you can see, that model does a very good job of both grouping the data together as well as giving us a low mean squared error at 0.73. This is that same support vector machines model, and you can see the gray values there are the model's prediction, and the black values are the actual data. The grouping is really good across the board. You can see that high cholesterol leads to a higher death rate, and lower cholesterol leads to less death rate in the data sets. The same thing for age category. It follows very well. The overweight and the uninsured are very scattered data to begin with, but the model does a fairly good job of following along with those categories and telling us a story about what the severity would look like if any given population had those characteristics. If you go to my Tableau public page, you can find this entire data set. And I've opened it up so you can actually go through and see how each of the characteristics compares to the COVID-19 death rate, and possibly you can come up with your own model. I believe you can download the data set that I aggregated, which presents COVID-19 severity versus each of these risk factors for the population. You can also look through each of the resources that helped me out with the project. There is a GitHub page that shows how the data was accumulated. This Tableau public link, both the Center for Disease Control's data sets, both the COVID-19 data, as well as the behavioral risk factor surveillance system. I also ended up using the Census Bureau's statistical regions, and I had to get a listing of counties by statistical region so I can aggregate the COVID-19 data. The American Obesity Treatment Association had a beautiful geometric diagram of obesity and diabetes, which really set off my desire to look at those two areas for COVID-19 severity. I also used the Tiger Line shapefiles, which you can get at the data.gov website. You can download those to map the Census Bureau's statistical regions, because for the most part, most software do not have statistical regions pre-mapped for you like states and counties are. And maybe the most important data set that I used was the CDC's SMART county survey data, which was very helpful in putting together this presentation. And thank you. If you have any questions or comments for me, please feel free to reach out. Have a great day.